and good morning. I'm here with Dr. Green, who has recently been conducting a study on untreated Lyme disease and its harmful long-term effect on the human body. Hello, Dr. Green. Please tell us about your study.
Good morning, Linda. First, I'd like to describe what regular Lyme disease is to the viewers. Lyme disease is a bacterial infection that is spread through the bite of a tick, most often a deer tick. The most common symptoms are flu-like symptoms, such as feeling tired, weak, queasy, achy, feverish, and also rashes are very likely. Where the tick has bitten the person, there is a bullseye rash on the skin. When you treat Lyme disease early, you are most likely put on antibiotics for 2 to 4 weeks, and then these symptoms will go away and you'll most likely be cured. However, in some cases, these symptoms do not show up, and the person can be living with Lyme disease for a long time before symptoms do show, and oftentimes these symptoms are much more detrimental and harmful. I've been studying patients who didn't realize or didn't know that they had Lyme disease and who experienced symptoms such as paralysis, heart problems, motor skill problems, and other serious problems. Alright, one of my patients, Eric, experienced an undiagnosed symptoms for almost 2 years. At least once a week, his muscles would start to twitch uncontrollably, and they would tighten so much that his fingers would turn into fists. His heart rate would go up out of control, and his blood pressure would skyrocket. His initial doctor had no idea what was wrong with him, and even as he described his symptoms, the doctor proceeded to tell him that it was all in his head. Because he didn't show the normal symptoms for Lyme disease, his doctor never tested him for Lyme disease. He visited neurologists, orthopedic surgeons, urologists, kidney specialists, and 3 different pain doctors. None of these found anything wrong with him. Diagnosis varied from heart disease to polycystic kidney disease to lupus. He had many different neurologic disorders, such as fibromyalgia, psychosomatic disorder, and neurosyphilis, according to all of these different doctors. His MRI even showed lesions on his brain, which stumped his doctors. No one could even figure out what was wrong with him. Eventually, Eric started to do some research for himself and got blood work done that included a test for Lyme disease. He tested positive.
That all sounds so terrible. What do you hope your outcome is for this study?
I hope from this study that doctors around the world will realize how much of a risk untreated Lyme disease is. When patients come in complaining of pain, exhaustion, heart problems, and motor skill problems, Lyme disease should be tested from the get-go. There needs to be more awareness of this disease because it is one of the most dangerous out there right now. More than 30,000 people contract Lyme disease a year.
Thank you so much for your time, Dr. Green. This is Emerson Science News Channel. I'm Linda Grayson, and I'm wishing you a good day.